Welcome to the deep dive. Today, we're plunging into a topic that, frankly, a lot of us think about privately, but it's rarely discussed openly. We're talking about penis enlargement, a subject just surrounded by shame, tons of misinformation, and yeah, a multi-billion-dollar industry. Our mission here is to really cut through all that noise. We'll look at the myths, the psychology, the medical facts, all for you.
It's so true, that kind of silence. It just creates this perfect breeding ground, doesn't it? For myths, for exploitation, and it genuinely impacts men's mental health, their relationships. It has real consequences.
Absolutely. And for this deep dive, we've gone through, the latest medical studies, talked to urologists, looked at clinical practice findings. We're aiming for a conversation that's scientific, yes, but also respectful and hopefully really helpful. So let's start dismantling this. Maybe begin with just the sheer scale of it, this myth machine. What does that look like financially?
Oh, it's staggering. Really. We're talking multi-billions globally.
Yeah.
And the insidious part, almost all of it is built on, well, complete nonsense. It's designed specifically to prey on male insecurities. They often use this idea of an easy fix, right? Vague natural ingredients, suggesting gentle but powerful change, tapping into that fear of surgery but promising impossible results.
Right. That makes sense. So for someone wanting actual answers, what do the big medical institutions like, say, the Mayo Clinic say about all those common products, the pills, pumps, creams you see everywhere?
Yeah, their stance is incredibly clear and consistent. Most of these products, they just don't work. Pills, vacuum pumps, exercises, creams. The scientific consensus is pretty unanimous. They're ineffective for any kind of permanent enlargement.
Okay, so they don't work, but how do these companies actually convince people? What are the tactics? It seems so pervasive.
Yeah, well, it's classic deception, really. You see fake before and after photos easily manipulated, testimonials from actors, paid endorsements, and they directly exploit very personal insecurities, sometimes creating a problem that wasn't even there to begin with. It's not just one type of product either. It's online miracle pills, devices on social media, even some unregulated clinics. It's everywhere.
It must be so hard to sort fact from fiction then. Let's tackle the most common belief, maybe, pills. Can a simple pill actually increase size?
That's just completely false. There's no pill, no supplement, no herb that can permanently increase penis size, period. And these unregulated supplements, they're particularly dangerous, often contain harmful hidden ingredients. Some have even shown traces of, like, heavy metals. They might cause some temporary swelling, maybe fluid retention, so it looks different for a bit. But it's not real growth. It's a trick.
Okay, pills are out. What about vacuum pumps? The idea of, physical stretching, it seems like it might have some logic.
It might seem logical, yeah, but the reality is disappointing and potentially harmful too. Pumps can cause temporary swelling. Some men might mistake that for permanent growth. But there's absolutely zero evidence of lasting size increase. And overuse. That can lead to serious tissue damage, even affecting erectile function down the line.
Then there's jelqing. I've seen whole online communities dedicated to this, claiming it's natural. That natural label makes it sound safer, maybe. What's the actual deal with safety and effectiveness?
That's a really important point. It sounds natural, but jelqing involves pretty aggressive manual stretching, and it carries significant risks. We're talking torn tissues, scar formation, even permanent erectile dysfunction in some cases. Despite those passionate online groups, there is just no credible scientific evidence showing it increases size. The only thing it reliably increases is your risk of injury.
So the medical evidence seems pretty clear. Why do these myths hang on so stubbornly? Why do so many men fall for this, even if maybe part of them suspects it won't work?
It's this powerful mix, isn't it? Desperation, meeting a real lack of accurate information. When someone's deeply unhappy with their body, they become incredibly vulnerable to, well, false hope. They're sold this story that their body's inadequate, but hey, there's a secret solution just for them. And it's not just desperation, it's also that societal silence we talked about. It stops men from checking facts, seeking real help, makes them more vulnerable. They're kind of searching in the dark, and these industries just exploit that.
That exploitation of vulnerability is a really key point, which brings us nicely to the underlying driver, the psychology behind all this size anxiety. What's really going on there?
Yeah, this is where it gets really interesting and, honestly, quite sad sometimes. I've worked with many men experiencing what's sometimes called small penis syndrome. But here's the crucial thing. It's often not about their actual size at all. Most men worried about their size, they're actually completely normal. Their measurements usually fall well within the average erect range, 5.1 to 5.5 inches, based on lots of solid studies. I remember one client just convinced he was an anomaly, until we actually looked at the numbers and talked about how common these feelings are.
So for most men, it's not a physical thing, but more about perception, a distorted perception. What causes that gap?
Precisely. It's perception distortion. Research shows it again and again.
Mm.
Men tend to overestimate what's normal and underestimate their own size. There was even this fascinating study where self-reported sizes were way bigger than when they were actually measured directly. It's
Yeah.
like, yeah, it's a weird reverse self-deception.
And what are the main things feeding these distorted perceptions?
Oh, several big ones. Pornography is huge. It creates totally unrealistic expectations, camera angles, performer selection, editing tricks. It's not reality, it's entertainment. Then social media just amplifies those unrealistic body ideals constantly, nonstop comparison. And then there's this interesting thing called the locker room effect. Basically, men see their own penis looking down, but they see others from the side. That perspective difference makes others seem larger. It's an optical illusion that feeds insecurity.
That locker room effect. Wow, that's fascinating, but also really quite heartbreaking when you think about the psychological impact. Have you seen this anxiety play out in surprising ways in your practice? How does it really manifest?
Absolutely. I had a client, perfectly average size,
Wow.
but he got so self-conscious, he started avoiding intimacy altogether with his long-term partner, convinced he wasn't enough.
Yeah.
And that's the heartbreaking part, the impact on relationships. I've seen guys avoid intimacy and relationships develop severe depression all over a perceived problem that just isn't there objectively. It really erodes self-worth. We need to be clear when normal concern becomes something more serious. It crosses a line when it really starts messing with daily life, relationships, mental health. That's when it might indicate something like body dysmorphic disorder. Men spending hours obsessing, avoiding social situations, maybe trying dangerous enlargement methods, even against better judgment.
Okay, so given all that misinformation and the psychological weight, if someone is genuinely struggling, what are the real evidence-based options? What actually works, if anything?
Well, there are a few options that have, let's say, very limited scientific support. And they come with big caveats. Traction devices or penis extenders. Some small studies suggest maybe minimal increases in length. We're talking less than an inch usually, but that's after months of daily use, often for hours a day. And the catches are huge. Small studies, modest results at best, and many men find them really uncomfortable, even embarrassing. Compliance is a big issue. It's a massive commitment for a tiny, often unnoticeable change.
And surgery, that sounds pretty drastic.
It is drastic, and surgical options are, frankly, highly controversial, even among doctors. There are procedures like cutting the suspensory ligament for more length, but that can reduce erection stability, making sex harder. Not ideal. Girth enhancement using fat injections or implants carries serious risks. Infection, scarring, uneven results, sometimes a very unnatural feel or look. Often the results are visually underwhelming and functionally problematic.
And I bet these are incredibly expensive, on top of the risks. What's the cost for such iffy results?
You're absolutely right. Extremely expensive, often tens of thousands of dollars. And insurance almost never covers it because it's cosmetic, not medically necessary. And frequently, the results are disappointing or there are complications, leaving men worse off, frustrated, broke, and sometimes needing more surgery to fix things. So for anyone struggling, my advice really boils down to three things. 1, get accurate information. Measure properly. Use the bone press direct length method, pushing the ruler into the pubic bone. Get a real number. 2, understand what's actually normal. If you're in that average range, and most men are, then the issue isn't your anatomy, it's perception. And 3, even if you are genuinely below average, which is rare, the focus needs to shift. Research is so clear on this. Sexual satisfaction has very little to do with penis size. It's much, much more about technique, communication, emotional connection, overall health. Your body is for connection, not just measurement.
That's a really powerful way to reframe it. So if changing bodies isn't the answer, then the real conversation we should be having is about changing perspectives, challenging these bigger societal messages.
Absolutely. This is crucial. The real conversation isn't about penis size. It's about male body image. It's about mental health. It's about our cultural definitions of masculinity. You know, we live in a culture that constantly tells men, be bigger, stronger, more powerful in every single way. Your muscles, your bank account. And somehow, penis size gets tangled up in that, becoming this disproportionate symbol of masculinity, of power, of a man's worth, which is just incredibly damaging.
And that message gets amplified, like you said, by social media and definitely by pornography, which is so easily accessible now, especially for young men.
Exactly. And using porn as sex ed, it's like learning to drive by watching Fast and Furious movies, right?
Yeah.
It's entertainment. It's designed for arousal, not as a guide to healthy intimacy or realistic bodies. It gives a completely warped view. What we should be teaching in good sex ed is communication skills. Emotional intelligence, understanding consent, accurate anatomy, especially female anatomy. That's far more relevant to sexual satisfaction than male size.
Hmm.
So many men obsess about their own size, but know remarkably little about their partner's body and pleasure.
And those partner satisfaction studies I've read about seem to back this up, don't they? That what women actually prioritize is often totally different from what men worry about.
They absolutely do. Study after study shows women prioritize emotional connection, foreplay, communication technique, way, way above size. Yet men get so caught up in their perceived inadequacy, obsessing over the one thing that often matters least to their partners. They neglect the things that actually build intimacy and pleasure. It's a really tragic misalignment. Therapy can be incredibly helpful here, especially things like cognitive behavioral therapy, CBT. It helps challenge those distorted thoughts, improve body image, develop healthier views on sex and masculinity. It helps men see that the anxiety often comes from outside pressure, not some internal flaw. And for partners or friends wanting to help, listen without judgment. Please avoid the size jokes. They're rarely harmless. They can really cut deep. Encourage professional help if the anxiety seems severe, and model healthy, realistic attitudes about bodies yourself. Reassure them their worth isn't tied to this one thing.
Let's touch on the controversies here, too. From a regulation standpoint, should these products, these procedures, even be legal given the potential for harm and deception?
That's a really tough question. It definitely points to the need for much stronger regulation of the whole enlargement industry. You have so many products making medical claims with zero scientific backing, zero oversight. It's that classic clash between personal autonomy and public safety.
And the FDA has issued warnings, right, about some of these.
Yes, they have. Especially for products claiming to be natural, they seem harmless. But some have been found to contain hidden, dangerous pharmaceutical ingredients.
Yeah.
Basically, unregulated drugs. Consumers have no idea what they're really taking. Potential side effects, dangerous interactions with other meds. It's risky. Even the surgical industry is controversial. You have some legitimate urologists who might offer procedures in very specific rare cases, but many others refuse entirely. They argue it's purely cosmetic for a non-medical issue, and the risks just don't justify the potential benefits, which are often minimal anyway. And then there's medical tourism. This is incredibly dangerous. Men travel abroad for cheaper procedures in places with less regulation. We see botched surgeries, serious complications, needing complex, expensive reconstructive surgery back home. It's a huge gamble. So what needs to change? Well, better sex ed, for starters. Education that focuses on communication, healthy body image, not just biology, much stricter regulation of these unproven products that prey on insecurity. And more broadly, a fundamental cultural shift in how we talk about masculinity and male bodies. Moving away from harmful stereotypes. Social media platforms, too. They have a role. They should do way more to regulate ads, targeting insecurities, making bogus medical claims. At the very least, clear warnings. Not FDA approved, no scientific evidence. There's a responsibility there that's often ignored.
As we start to wrap this up, if there's one key takeaway you want our listeners to hold on to, what would it be?
It's this. You are not alone. Your concerns, even if they stem from misconceptions, are valid feelings. Help is available. And most importantly, your worth as a person, as a partner, has absolutely nothing to do with your anatomy. Nothing.
So for someone listening right now, maybe feeling that intense anxiety, what's the very first concrete step they can take?
First step, talk to someone, a trusted friend, a therapist, your doctor. Break that isolation, that shame. That's huge. And please, please don't waste money on ineffective, possibly harmful products. It just leads to more frustration and lighter wallets. For reliable science-based info, check out places like the International Society for Sexual Medicine or the American Urological Association. They have good resources. And if it's really impacting your mental health, body image issues, anxiety, depression, reach out to a mental health professional. They really can help you reframe things and build healthier self-perception.
And if it's causing relationship issues, the fix isn't changing your body, it's improving communication, maybe couple therapy, right? Addressing the real dynamic.
Exactly. A good relationship thrives regardless of anatomy. Changing your body won't fix a bad relationship, and it won't magically enhance a good one either. Connection comes from within, from how you relate to each other, not from a measurement.
So maybe a final thought for you, our listener, to take away. Your body isn't the problem. The problem is a culture, an industry that profits from making you feel insecure, telling you you're not enough.